The fall is upon us, cooler air has moved in, schools have started, whether in class or virtual, and the Lions continue to struggle. In so many ways, it feels like a typical Michigan fall. So it's hard to believe that it's been only 6 months since the first COVID-19 cases were confirmed in Michigan. And let's face it, the end of March and April were dark days for all of us, hearing about what was happening in New York and as close as Detroit. Although many of us intuitively knew West Michigan would have a very different experience, regardless, we had to be prepared for the worst case, and we were. Obviously, much has changed in that time, and all of us can describe the many ways our lives have been altered and changed. As a community, we can take pride in how we collectively stood up to the challenge of COVID-19. This required innovation, sacrifice, hard work, and above all, dedication to the patients and community we all serve. At Metro, we work closely with our sister healthcare organizations to plan for contingencies and to share best practices around PPE, testing, and pandemic modeling. Other leading West Michigan companies, both large and small, also generously stepped in to provide innovative options and products, including hand sterilizers, masks, and face shields, to protect frontline workers and vulnerable members of our West Michigan family. Just as we've never seen anything like COVID-19 before, we've also never seen such levels of innovation, cooperation, and determination throughout industries here in West Michigan. Metro, as an organization, focused relentlessly in supporting our own employees through innovative COVID relief funding, flexible work hours, and free childcare. Although the warm summer months and outside activities have produced a much-needed and deserved respite during the pandemic, the challenge of COVID remains and will continue with us for some time, so we must remain vigilant and ready. And despite the new challenges fall and winter will certainly bring, we should have every confidence that we as a community will again meet these challenges head-on, just as we did in April and May. Fortunately, there is good news coming from New Zealand and Australia, who are in the midst of their winter season. Influenza rates there are at record lows, largely felt due to taking precautions such as mask wearing and social distancing. And in terms of COVID itself, we are all in a much better place in terms of what we know about treating patients with COVID. It is encouraging that our finest medical minds are every day finding better ways to treat COVID, whether it's through known treatments like dexamethasone or convalescent plasma, or newer research focusing on the innate immune response and interferon-based therapies. We at Metro Health have been early adopters of many of these treatment strategies for our patients. We are also all anticipating that one or several vaccines will be ready in the near-term future, offering hope for a very different spring. Through all of this, we must not forget our frontline heroes in West Michigan, whether they be nurses, physicians, and allied health staff taking care of our patients, or essential workers in grocery stores and factories taking care of our community. These heroes are on the front line every day, risking their lives, and deserve our gratitude. COVID has also put a spotlight and brought to the forefront long-standing issues like racial inequality, health disparities, loneliness, and addiction that we as a community and in each of our companies must address. In terms of healthcare, COVID has been an accelerant and will have long-lasting and profound effects. Much of the talk in the last few years has centered around outside disruptors like Amazon or Google coming in to disrupt healthcare. While we welcome that needed disruption, it's also important to remember that when faced with the challenges of COVID, that it was our nurses, our physicians, and our healthcare delivery systems that stood up to take care of our patients and our communities. I'm confident that this experience will reignite true innovation that can only truly come from within. The challenge remains, but I believe we have already learned that we as a community are stronger, more courageous, and more caring than we ever knew. Most generations have a challenge that defines their moment in history. This is ours. Our legacy will be how we stood together, resolved to bring this crisis to its inevitable end, and opening the door to an even brighter future.